Are we on?
We're on.
All right. Welcome to Supercharge Your Health. This is going to be a whirlwind episode. We are here with Dr. Karen Helmick. Last week we talked about acupuncture, but then we decided to do a field trip and come see her facility. Oh my gosh, you are going to learn so much and you're going to see so much. So we're going to apologize to the podcast people. You're going to have to go to YouTube to Supercharge Your Health because you're going to want to see everything that we're going to do today. This is Beth Annie Stockdale, owner of Your Total Body. So happy to be here. Like us, love us, subscribe to us. After today, you're going to be like, oh, these girls are just crazy good. Seriously. All right, and I'm here with my partner in crime.
I'm Suzanne with my flower chakra crown today.
Oh.
With Discount Med Direct. We're at 2414 Tamiami Trail, Unit 1 in Port Charlotte. You can call me at 941-421-7155. You can reach us here at info@healthsupercharge.com or find us on Facebook at Supercharge Your Health.
And we're here with Dr. Karen Helmick, and tell us where we're at.
We are at Healthy Body Acupuncture. It is in the Southbridge Plaza here in Venice. So it's 1511 Tamiami Trail South, Suite 202 here in Venice, Florida. And it's difficult to GPS it. So definitely know the Southbridge Plaza before you leave. It's facing the Circus Bridge for those of you who are local.
I think the best way would be to describe it is it's kind of behind Starbucks.
Yes. Most people tend to know where that is.
Most people know where Starbucks is. It's right on the corner over there. I know, you don't drink Starbucks.
Right.
The rest of the world drinks Starbucks.
We're tucked in quietly, but easily accessible from 41. So
yes.
I love this location. And we've been here now for 3 years. So I am happy to welcome you to the practice.
And there's so much going on here, so let's just jump in. So last week we talked about acupuncture, and we talked through what acupuncture is and what acupuncture does. However, I'm a very visual person, so we decided to come do a field trip, and so that we can actually see when we're talking about the meridians, where they are and how they're connected. And see, for those of you who have no clue and have never seen acupuncture done or anything like that, we're not going to do acupuncture today. But we do have a needle that we're going to try to show so that you can see, seriously, how teeny weeny tiny it is. So I'm going to try to zoom. I have it in my hand. And I'm going to try to get close enough. Here we go. So, Suzanne, you tell me whether or not we can see it.
Yep,
again,
that's good.
In your traditional hypodermic needle that most people are talking about, 23 of these actually fit. They are tiny. They are flexible. They are hard to see. So you
They are hard to see.
The handle actually is the pink part.
Right.
And then the very tip is what we're working with.
Yeah, on the screen it almost looks like a hair, you know.
Yes.
Whoa, and
It is like a dog or cat whisker. That's the size of it.
And
So
it's not very long at
tiny.
all. How long is it?
No, they have different varying widths. This is one that I would use for a very shallow insertion. So
Okay.
for facial acupuncture and different things like that, which we will get into later in talking about that. But they are known to be some of the most comfortable needles that we ever have because they're the Sarin brand, which is one of the ones that they work very, very hard to make sure that their needles are the most comfortable that you can find on the market.
So you would have different lengths of needles depending on where you're inserting them.
Correct.
All right.
And what the purpose is.
Okay, can you go ahead and explain that a little bit?
So if I were to actually try to work on a trigger point or a muscle, that might be at different depths. So one of the most deep needling that I would actually have to do is for the piriformis, which is in our tush here. But it's one of the deeper muscles, and it does extremely well with actually you just touch near the muscle. So it's actually the nerve that innervates that actual muscle, not the actual muscle fibers itself. And it releases so nicely, and it's almost instantaneous relief for low back pain, hip pain, all that kind of good stuff. It even relieves a lot of times bursitis pain because of the attachment of that piriformis muscle. So we can get a lot of relief with that deeper needling just in that one area. I would go more shallow if I were to do any of the points on the torso near the lung.
Well,
that is one area where, you know, the lung can go pretty high.
All right, so to demonstrate those,
Yeah.
we have a guest here today.
This is Dottie.
And Dottie lives at the beach. You can tell
Dottie,
she's
yes,
got a little
she's
bikini
so
on.
tan. You
She's
know?
very good with her sunscreen, though.
And so what we have done with this, just as an example to show folks, is we've actually marked out the different meridian pathways on one side of the body. So this whole side would be a repetition of these meridians. They go from head to toe. They go from fingertip to, your little toe, your little pinky toe. So the different pathways, the roadways that we use are used for different conditions. They're used for different communications within the brain. And so some of the strongest points that we would use are actually the furthest away. So one of the big ones for a headache of any kind is between the webbing of your thumb and this first finger. You actually press and massage in that area really deeply. That can sometimes alleviate a lot of the different tension headaches and just stress headaches that we have, all of that other good stuff.
No, it's not in the webbing itself.
No, it's a little bit in that fleshy part. In
Okay.
fact, it's if you put them together, where it's the most fleshy is where you want to press.
Okay.
And it is an actual pressure point. If you've ever taken any like karate or any martial arts, it is one of those pressure points that you would get to try and get somebody to let you go if they had grabbed onto you or something like that, because there is a lot of overlap between the martial arts, because again, culturally they were exposed to the acupuncture points.
So they knew where they were.
So
And
they did.
that is something I heard years ago. And if I don't have any other way to relieve a headache, I'll do
Okay.
that. Or I'll do that and, like as a precursor to the whatever, Tylenol or whatever kicking in.
Absolutely.
So can you show a little bit on Dottie where those meridians, like what connects what, just to give us an example?
They all of the channels interconnect.
Okay.
But they are separate channels. So the one that runs straight through the belly button, straight through the sternum, the throat, and then starts actually at the mouth is the Ren channel. This channel is useful for women especially. It helps to regulate menses. It helps to regulate digestion, especially if you have any diaphragm issues. But this is known as the feminine channel. So it is the feminine, thing. So if we're ever working on balancing hormones and different things like that, we tend to work on that channel specifically. A lot of my fertility patients and things like that, and we'll even address like a lot of times there's bladder collapse that will happen with women, and so we can actually help to energetically kind of lift that. It is a temporary thing because again, I can't change structure,
Right.
but I can absolutely fight against time a little bit, and try to change its mind. Like, we really don't want to fall. So we're really going to try to hold that in and to hold the focus of that. So I know that that's a lot of issue for a lot of women, and we'd use actually some Ren points to treat that. So that would be one of those.
Along with that, rather than lifting can we talk about incontinence?
Yes. Absolutely, it works for the exact same thing.
Okay.
But for male incontinence, we're treating more the kidney channel and the dew channel. So if the Ren channel is more feminine, the backside, if I can get her around easily, is this dew channel that runs along your spine, and that's the yang channel. So it actually starts where the Ren channel stops, and so they make a continuous and constant loop around the body. So they are always joined, they're always paired, and they are our extra meridians. So we always kind of I love to personally address that. And that's part of the art of acupuncture. A lot of practitioners have different ways of doing things. There's many different ways to reach the top of the mountain. Some might be quicker for you that are not so quick for you. So we have to, analyze what's best for each individual, and then what we work best as practitioners. practitioners with our tools,
Right.
because there are many
there's an
different
art.
tools. Yes,
There is an art to
absolutely.
it.
Absolutely. So there's many different tools, and that's kind of the focus a little bit of this presentation today,
Right.
is to show you guys some of the tools that are in my toolbox. They may or may not be in every acupuncturist toolbox. They might have different stuff that I don't even cover and I don't even focus on. So
Right.
there's many different things that we get to do, and we can explore, and we then take further education in whichever modalities we enjoy.
And then you can determine for yourself which ones are effective for you and which ones are not.
Absolutely.
Now, I think we touched on it last week that rather than even using the needles, acupressure.
Mm-hmm.
Do you and can you use all those same points with acupressure that are on body as you would with acupuncture?
You can. It's not as long lasting of relief.
Okay.
Yes, you absolutely can. There are a little bit of differences, like you'd have to keep doing it, and some of these points are very difficult for you to reach and do acupressure on
absolutely.
yourself. So absolutely, I would always recommend, if you're an adult, to go ahead with the acupuncture. For children, they're so receptive, it's almost overwhelming, and so we don't tend to needle children. You absolutely can, but it tends to be what they call a pecking. So you insert and take it right out. So it's not like you leave the points there and the child has to be still and all these other things.
I would see that would be the issue, is trying to keep a child.
Exactly. You
Sometimes
don't.
trying to keep them still.
It's like herding cats. No, you don't do that.
Okay. So it's. I really wanted folks to be able to see. Sorry, podcast people, but the meridians along the body, so they can understand. So, like when I had acupuncture, and because of my shoulder, they were putting the needles like on the side of my knee.
Correct.
And now I can see where that meridian from the side of the knee went up to my shoulder.
Correct.
And
That gallbladder channel absolutely goes there, and not only that, it wraps around the head several different times. So
Okay.
that's another area where if you have constant like pressure in your temples from the headaches and that kind of thing, or dizziness, that's one of the areas where we would definitely work very strongly, is that gallbladder channel.
All right.
Mm-hmm.
Okay. So speaking of dizziness, we're going to
Are we going on to that?
We're going to segue
Sure.
into. You had said something.
Not time to hold up my tongue.
Oh,
yet.
wait a minute. Let's talk about the tongue. I forgot.
Do the tongue first?
Yeah.
So
Okay, so you
one of
take
the
the tongue
areas
and
of
pulse up there.
diagnostics, flip it around, is we look at the tongue and pulse. Again, other practitioners will use some of the other modalities. You can actually look at a person's eye and the actual iris of that and diagnose from there. I prefer the tongue. The tongue is laid out like the human body. So the
You're
heart
better
is at the
closer.
tip of the tongue. The lungs wrap around that heart area. On either side, we're talking about the liver and the gallbladder, because back 3,000 years ago, they didn't realize that we have a spleen. And so a lot of the spleen's actual duties fall under the liver. The spleen itself, they call the digestive area. So they've lumped it in with the spleen and stomach. So the spleen in our medicine covers kind of the pancreas, it covers the stomach, it covers some of the digestive functions and all of that other good stuff there. And then in the back is the kidneys.
So we're talking about the coloring of the tongue.
The
correct?
coloring of the tongue, if there's any lines or cracks,
Ooh.
if there's tooth marks, if the tongue is enlarged, if it's pointed, if it's deviated to one side.
Oh my gosh!
If we actually are looking at a tongue, we can usually predict an actual heart attack before they happen.
Oh my God.
And I think it's like up to 3 to 5 days out. Please correct me if I'm wrong. But the tongue will actually deviate to the side, and they will, you start to tell them, hey, get in to see your doctor. If you can't get in to see your doctor, go ahead and get some aspirin, have some nitro nearby, and those kinds of things. And
Well,
just
and
to try to prevent it.
It's like the film too, or the
Yes,
the
the
difference
coating of the
between,
tongue
like,
actually makes a difference too. The color actually will change, and you don't even realize it until you've looked at thousands of tongues that it's just like, whoa, that is really different.
I'm even looking for deviated tongues now. From now on.
Exactly. Like, hold on, you need to go see your doctor. Go see your resident MD.
It's funny because that's one of the stroke symbols
Yes,
is stick
yes,
out your tongue. And
yes.
when my mom had her TIA, I'd never looked at my mom's tongue, so I didn't know what it looked like, but we were doing the stroke test with her, and she stuck out her tongue, and I thought it looked weird, but I didn't know, because I've never looked at it before.
Yep.
So, maybe that's a thing to do, is especially if you have older family members, to just take a look at their tongue every once in a while,
All right, so everybody should be fingerprinted and have their tongue photographed.
Stick out your tongue. Stick out
We're all
your
going to
tongue.
get baseline tongue photographs so that we can tell whether they're being deviated. I mean, this could be, we're joking about it. But
it is a serious matter. It really is.
And the thing is, your tongue is a part of your body just like your finger is. Right? Just like your foot is. It's part of you. So go look in the mirror.
And one of the other major things that we actually look at when we're looking at the tongue is if there's any black area. If there's actually a black spot, it is very indicative of cancer. And I actually diagnosed a patient, not just from the tongue, but also from palpation and her history and everything else. I said, you, I think, need to get further testing with Western medicine. And this was our first visit, and I was really insecure about telling her that because I don't want to be seen as some like hoodoo voodoo thing, but all signs were pointing towards cancer. And she actually ended up with having kidney cancer. And she was in the process of getting married for her second marriage, and she was blissfully happy and all these other good things. But she was able to, have that time, and she did later pass away. But I felt just so good giving her the gift of that knowledge.
Well, yeah, and we talk a lot about that your body sends you signals when something's off. And whatever brought her to you, to have you in a position where you actually would look at her tongue to be able to see it.
Yep.
That was her path.
Yep. Right?
So, and we talk a lot about that our bodies, when something is off, will show us.
Exactly.
And whether we're in a position to see it or you're paying attention and don't ignore it. And
Correct.
the sooner, the better.
Absolutely.
Your gas, your constipation, your diarrhea, whatever is out of the ordinary, that's your body saying something is out of balance and pay attention.
Absolutely.
Yeah.
Absolutely.
Your tongue gets deviated. All right, so let's talk about the ears.
Okay. So let me show you an example. We talked last time about the actual ear. We know position-wise that it goes on the body like this. However, this is what I'm talking about when I say that it is like a human being that's in the fetal position. So the head is represented here, spine is right here, all the internal organs are laid out exactly where they actually are in the human body. And so we can use this microsystem to treat the whole body. So it's not like I put in a point and it says, the hip point. It's not going to go send the signal directly to the hip. What it's going to do is it's going to send that signal to the brain where it registers for the hip.
Oh.
So it's got a real short pathway because it's right next to your brain. So,
right,
so
but
it
it's
doesn't
your
have
brain.
to show it all the way down to the hip. So yes. Absolutely. So we were going to do a little bit of ear seeds. And they are called ear seeds because... and a lot of practitioners actually still use this. There are vicarious seeds. Can you see that?
Yep.
Okay.
I put the paper behind it just because it's unclear. So
Yep. So they are teeny tiny little vicarious seeds.
That way. There we go.
Okay. And they have a rougher texture sometimes, and they're not consistent as far as size. So I don't like to use those. What I like to use are little tiny seeds, or what we call seeds, but they're on an actual metal clear sticker. So let me take one of these off and put it on the paper so you can see just how small they
almost
actually
like a little
are.
roller.
It's a little tiny silver roller ball.
Or a teeny weeny weeny.
And so you can actually use these as acupressure. They are extremely comfortable, and if you actually take some time, I've had some patients that will leave them in for quite some time, meaning almost a month, because I actually have worked at the VA, and once a month I go and volunteer at their wellness clinic, those veterans, because they're phenomenal, this treatment, not a treatment, is actually phenomenal at treating patients for PTSD and all of the things that are associated with it.
Well, we know PTSD is affecting certain parts of the brain.
Absolutely.
And if that pressure point can go send a signal to that part of the brain.
Absolutely.
There you go.
Absolutely. So I always like to talk them through. So the bigger points, this is a phenomenal treatment for anybody who has sleep disturbance, who's really, really stressed out, who's trying to lose weight, who's trying to stop an addiction. Because what it does is it just brings you into that nice dopamine zen state. It just calms you all down. So I don't feel so stressed out that I have to go smoke or have to go do this or have to go do that. It's a really wonderful treatment, and it's just 5 different points that are auricular in the ear.
Okay, you mentioned the dopamine. So if I do a brain assessment, because I'm a brain health coach, and what I find is that somebody's got some ADD going on, the prefrontal cortex is dropping, and we need to raise up their dopamine, you can do it with those.
Yes, absolutely. Absolutely. I see a future podcast. I see some joint work going on here.
Yeah, because there's like 7 different forms of ADD, right? We're all different. Some of you need more dopamine, some of you need more serotonin. So just because you think you have ADD, it's not an automatic you need more dopamine. Correct. But there's certain types of ADD and ADHD that do need the dopamine. So take it away.
Correct. So we are just going to apply a few of these seeds to your ear today, just to show a nice little example.
Talk about what's going on with you?
Sure. So, I mean, I have all of those things. But I had a situation this morning where I took my dog out, and the neighbors were dog sitting, and the dog that they were dog sitting for they thought was not a very friendly dog. So they didn't realize I was coming out. The dog got out of its collar, ran over, and they thought was going to attack my dog. So I was trying to keep the dogs apart. My neighbors are not very quick-moving people. They're a little bit older, and the gentleman has a cane, so they couldn't get over to me. Plus, they had 2 other dogs that were outside with them. So by the time I got done, I was, my heart was racing. Took my dogs home, and then I hadn't eaten breakfast yet, and then I didn't eat breakfast right away. And so I was feeling a little lightheaded as I left to come here today. So between tapping and after us talking about the happy point, I was tapping on the top of my head on the way here. So I volunteered to get the ear seeds.
Absolutely.
Right. So a little stress.
Yeah, a little stress. And I mean, we've talked about it before on the show that I haven't been sleeping well for a while. So that's an ongoing thing for me. I mean, and I have my own business. So as we all know, we're business owners. That can be very stressful. And so, just everyday life. But
so can you explain, Karen, what you just said to her?
So let me actually get the ear so I can show the points a little bit easier. You can try and see on your ear, but I think they're going to be too small.
You can't even see, they're so small.
Most of the time, you can't even see them, and most of the time the only people who actually notice is if they're cutting your hair.
How many of the seeds did you put?
I put 1, 2, 3, 4 in for her today.
All right, so you want to do it on that ear?
Yes, so what I did was Shenmen. What I say this one is it takes the needle off the record player of those repetitive thoughts and worries. Those things that we can't do anything about, but just it kind of closes the loop. Because those things will just keep playing and playing and playing.
And there's a particular part of the brain
and everything else.
Right. There's a particular part of the brain that's where those thoughts get stuck.
Absolutely.
Yes.
Then I did 0.0. So this is our good grounding point, and it just allows you, I always say, to take a really nice deep breath. It is right on where the actual diaphragm is in our bodies. And so it just kind of helps with that meditative, peaceful state to kind of come into yourself. Anytime we have a big shock, like potentially like your dogs could have gotten harmed and things like that, and big stress, it's almost like everything goes off, like a bomb goes off in your chest. So it depends on how big that bomb actually is,
right.
But that can really be a helpful point for you there. I also used the heart point right in the center here. And again, that just kind of coalesces everything, brings you back into who you are, who your spirit is, and says, okay, I've got this. And then lastly, I used one of the brain points that is over on this side. It's not actually marked on my ear, but that one helps with vertigo, dizziness, nausea, all of those types of things. So it kind of just brings everything ratcheted back down after that kind of a treatment. So
now, do you feel anything?
No, I mean, I felt, her touch me when she did them, and I'm like now trying to feel them. I can feel the one that's in the center, but I
when
can't.
You're pressing.
Yeah, I mean, like I can't even find the rest of them.
Yay!
Like I don't even know where they are.
So how long will she leave those on, and does she need to come see you again to have them taken off?
No, you can either take them off if you find them still on about 2 weeks out.
Oh, wow.
So go ahead and just take them off if you still have them in, just because we want to switch them out. And that's also why I only used one ear. Because next time we see each other, I'll use the other. Because again, we don't want to over-irritate that area, causing a scar, because that's going to cause the point to move and shift and go somewhere else. And we don't want to cause that to happen, which again is why I talked about the piercing that works for a little bit for migraines. But then as soon as it starts to heal, that point finds another location. So we haven't gotten to the root of the problem. So absolutely, if this is something that kind of keeps on going for you, this helps in the moment, but we haven't gotten to the root of the issue. So I would say that yes, another treatment would be very justified.
So will she get relief from this first application?
Oh, absolutely.
And about how long will it take before she starts feeling, or is it going to be one of those really subtle things that
it's very subtle.
Okay.
Again, it just kind of closes the loop, and probably even before the end of this video, she'll be just, okay, yeah, it happened, but not so keyed up kind of thing.
And the way we describe it is you go into the fight or flight.
Correct.
Right? And what our body should do after the fight or flight is recover.
Yes.
And so basically when you were talking, what I was envisioning is her body
just coming back
down
yes.
and recovering from that fight or flight. Like dumping the cortisol, getting rid of it.
Yep.
Yeah. Okay.
And because these are just little tiny cylinders on a sticker, they will occasionally fall out. No big deal. You don't have the baby doesn't get thrown out with the bathwater with this treatment. It does still keep going. Just before you go swimming or before you actually jump in the shower, give them a little press just to make sure that they are sealed, and then you can go about your day.
I found 3 of them.
You're going to have to show them where they are.
Oh, absolutely.
There's one here, and there's one in the center, and there's one here.
Yep.
I don't know where the fourth one is.
Right inside the ear, right here.
Okay.
Yep.
I think I know where they all are now.
All right.
Okay. All right. So the next thing I think we're going to talk about is cupping.
Yes.
No, I don't think we talked about that last week. So describe what cupping is. And
so
what it's useful
cupping
for.
is actually the reverse of massage. So massage, you're actually pressing into the muscle tissue. With cupping, you're lifting it up. And what the whole idea and philosophy is that we're actually lifting the different detritus that's actually there near the muscle. So a lot of times what is going on is we've got blocked energy, and that's where you're going to have pain. A lot of times also you're going to have, some damage, some muscle tissue damage. So this is phenomenal for trigger point therapies and different things like that. I will actually put a cup on, let it sit for a few minutes, and then do what we call running cups, which is take that cup and actually lift it up and pull it back and forth, and it feels phenomenal.
So,
absolutely
so
phenomenal.
what conditions,
Yes.
for all of our viewers out there and our listeners, what kind of conditions will cupping treat?
So not only that one really super tight knot that you might have, from sitting at the computer all day and everything else that we always have. Not only that, but we actually can use it if you're getting a cold in your lungs or anything like that, because it's going to, again, pull that meridian out and actually trigger a response and reaction in your body. So it's pulling the toxins towards the surface so that your body can actually dissipate those and clear those out a little bit. bit better.
Oh, okay. Because that's why I was wondering what the lifting was achieving, and it's actually moving the toxin.
Yes. So when we have that tight knot, things are not moving. They're not getting away from there. And you're actually like just adding more fuel to the fire. It's almost like that treadmill, of different stuff. And it's just, you keep loading it up with the blood and the fresh blood supply, but you can't get rid of it. So it just keeps glomming onto each other. So what this does is it lifts it all up. You're better able to get rid of it then. And that's also why you look like you've been kissed by an octopus. Not that anyone's ever had a hickey, but
well, and I think
probably
anybody that
know.
watched the last Olympics,
Oh, absolutely.
they were using, a lot of the athletes were using it.
Correct.
Michael Phelps is the one that
Correct.
comes to my mind, and what did he
Absolutely.
win? 12 gold medals, I think, in the last Olympics.
Just a few.
Well, you could see him when you watched him, even when he was swimming, you could see across his back that he had these red spots that he had used for recovery, I think, more in his case.
And the biggest thing that I keep getting asked is, does it hurt? Because it looks
Well, we're
like it
going
would
to find
hurt.
out.
All right.
You got the little thing. I'm going to get
I
some.
do.
I got the one that doesn't hurt.
I know. Did I volunteer for this? I think I did.
I think you did. I'm gonna.
Okay. Now, we had talked about me laying down or not. Would you be able to do this spot up here on my shoulder without me laying down or no?
Yes. If it's that high, yes.
Yeah,
I can
it's this high.
absolutely do
Okay.
that.
So then she's gonna do
So
your shoulder.
I
I'm
do
gonna move.
fire cupping, which means we've got
I
rubber
volunteer for
legs.
this. I have a sports bra on, by the
It
way.
looks nice and fancy. So fire cupping just simply means that we're going to suck all the air out of the cup and apply it. So hold on one second. I didn't do it quite fast enough. There you are.
Oh, that feels good.
There you are.
Can you turn just
Okay,
a little
that-
bit this way so
Okay,
that
that
we
was
can?
like the craziest thing I've ever done.
Oh, just you wait. Hang out with me, kid.
Oh, really? You know, Gwyneth Paltrow, we've got nothing on you. You've got nothing on us.
And she's a huge fan of this.
I know, really.
All
I've
right.
never seen this done on Goop.
And
All
so
right?
running cups would actually just be moving it back and forth and lifting it up. But we're not going to do that to her because we didn't prep the skin beforehand with using a little bit of oil to make it move a little bit quicker.
Okay.
But you don't even have anything on there, Come on.
That's all it does?
That's all it is.
Okay, that didn't hurt at all.
That's all it is. And it
That's
feels actually really good.
It looks scarier than it was.
If you'd like, we can do it again.
Do it again.
Okay. Once
I just
again,
want to
give
wait
it
for
a
it
tap.
now that I know what's going to happen. And that's why we do these episodes, because all this stuff that is, this is new to me too. So that it's not that unfamiliar now. It's not that scary, crazy, what is she doing with fire
Exactly.
and sticking it in a
I
glass
had
thing?
I was in Chinese medicine school, and I actually, hold on one second. I actually was at
This
a
is
party,
fun.
and I met with a guy who, his whole thing was, he was a social worker for children, and he had a case where the child had been cupped,
Oh, that feels good.
and because they were ill with a cold, and the child had been cupped, and it looked as if the child had been abused.
Oh, yeah.
Because if you don't understand, you see a bruise. I absolutely understand. And so I offered this guy, I'm like, please let me show you that this is not abuse.
Right.
This is actually a mother trying to take care of her child using home remedies, and this is her kind of medicine. And the guy was just adamant, no, that's going to hurt. And I mean to tell you, it does
No.
not hurt. And
And-
I don't know what happened with that case, but I sure do hope because of our lack of knowledge, we didn't take that child away from a parent.
Right. And the first time I had ever seen anyone in person, see, I missed the whole Michael Phelps thing, was I do water workouts. And I went to someone's home to do their workout, and the gentleman had all these round cylinder.
So you can see just a little bit on there, but you're so tan. It's hard to even see it.
Yeah, you're not. I mean, it actually looks like a spot, but it's right here. So we're not seeing the redness of where it actually is.
Okay. Yeah, I was actually doing a water workout with someone, and this gentleman looked like he'd been beat up, but all the marks were cylinder.
Yes.
And there was another gal that I was doing the workout with the two of them, and she's like, "Did you see his back?" And I'm like, I'm doing all this kind of stuff. She's like, oh, he had a cupping treatment. I'm like, seriously, tell me more.
Mm-hmm.
Right.
So it absolutely does. It feels really good.
It does.
It feels like a very deep massage, but it's not deep. So it's hard to describe.
And that's it. And some people are uncomfortable with massage because of having to put that pressure.
Absolutely.
Like they're not comfortable with that. This is, the heat just was like.
It's so nice.
So what's the other way if you don't use fire?
They actually have suction cups on top, so you would actually suction the air out. So all it is just releasing the air from the actual.
And do they come in different sizes?
Absolutely.
I was going to say, because the spots that Michael Phelps had were big.
Absolutely.
They were probably...
They even come in heart shapes.
Yeah, I was going to...
they're creative now.
But they were probably, I would say, from the looks of it on TV, about 6 inches around.
Mm-hmm.
Oh, wow.
Yeah, because he had them you could see all over his back. Big spots.
Right. Heart-shaped ones?
Yep.
Oh, that's sweet. All right, so get in contact with her for Valentine's Day.
I was going to say, is that a Valentine's Day?
That's a Valentine's Day.
We might have
anniversary present.
Anniversary present. Cups together, stays
together. We just starting a whole.
This is just selling itself.
Serious, I'm sold. All right,
so I'm going to go back over here.
Moving right along, we have one more thing that we want to talk about.
Yeah, one more thing we wanted to show. So I actually do acupuncture facelifts and acupuncture facials, if you will. So the use of actual small, teeny tiny acupuncture needles in certain places in the face, because our face, as we age, actually shifts down and forward. Mm-hmm. So that's how you get the little jowls, the couple extra chins that nobody in this room has whatsoever.
No, we don't.
I've had this double chin my whole life, though. It's not.
Well, some of it hereditary?
Some of it is.
I don't know that anyone. Well, maybe my grandmother had it. I don't know. I don't remember. But I've had this forever.
What it does is it actually tightens those muscles so that you have less forward movement overall. Nobody seems to know that you've had any work. They just ask you, have you been on vacation? Are you less stressed out? What's going on with you? You look fantastic. I always say that it takes about 5 years off of where you actually are. So can I do super deep wrinkles and make them go away? No, because it's not Botox, it's not a filler. But what it is it's triggering your own body's natural collagen and elastin. So I do have homeopathic injections that do that very thing. And so we can get that collagen and elastin kind of placed. It's always systemic because it's not a hard liquid that we're putting in there. It's not a filler. But at the same time, we can place it near the area of concern. So for myself, I should probably do my own lines right across the forehead. So I would actually do 1 to 4 injections across there for all of the lines. Because again, it's systemic. And all we're saying is, please put more collagen here. That would be wonderful if you would do that.
So, okay, I need clarification.
Okay.
So you do some type of injection?
I can, yes. In the state of Florida, if you have more licensure, you have to go get certified and licensed to do injections.
Okay.
But I can do different vitamins, I can do different herbs, and I can do homeopathics as far as my injections are concerned.
And you were talking about collagen.
Yes.
Now,
and it's homeopathic collagen.
It's homeopathic collagen, which is so much safer.
Mm-hmm.
But that's different than the acupuncture facial.
It's both. I meld both together in a nice treatment. So whichever you need is covered by your package.
Okay.
Then what we do is we also utilize a laser
you're gonna have
while
to
you're
move
resting.
that over this way towards us because we can't see that.
So the redness is going to take down inflammation, and the blue can help reduce some wrinkles. The green is also pretty fantastic as far as encouraging some different healing and rejuvenating to go on. So there's a lot of different things we can do while you're resting and relaxing. This is just
this goes over the face?
Mm-hmm. Yep.
Can we turn it to show the light?
Oh, sure.
I mean, can the light show the...
It's going to be kind of bright, but...
Yeah, it's fine.
And you're always wearing a an actual kind of a eye protection while you're there.
Okay.
So this is in conjunction with the other two things, which are the injections and then the
So you can get
acupuncture.
some idea of that the lights are different colors.
Yeah, you can. It's
Okay.
showing up really well on the
Okay,
screen.
cool. Okay, so you would just literally have this over top of you while you were laying and
Yep.
resting?
Yep.
And that tightens the skin
Yep.
up?
And every time we work on the face, we also work on the root of it. Why, you might have those dagger lines in between your eyebrows. It's
These
always
ones?
stress. It's always stress. So while you're here and I get to do an acupuncture facelift on you, or facial, whichever way you want to call it,
Right.
we are going to work on reducing your stress level as well. So we would work on the liver is a big one for that. We'd work on the kidneys because that's your well of energy, and that's your youth points is all your kidney points in that kidney channel, and try to nourish that. We talk a lot about hydration and how much better you can do just if you're getting your pure water and enough water throughout the day. So lots of different things that we would talk about that you can do throughout your lifetime to make sure that it not only lasts, because it should last about another 5 years to catch back up to where you started from, but it's not indefinite. And so what we tend to do is we have a package of 10. We get some results and some results and some results. So I
Right.
see you for approximately about 5 to 6 weeks weekly for these treatments. And then as you decide that you've reached where you want to be, then we space out the rest of the treatments as maintenance.
It makes sense because our faces didn't get this way overnight.
Correct.
Ladies.
Correct.
Right?
And sometimes the changes just take time to see.
Right.
They're
Now-
happening. We just haven't seen them yet.
Right. And it's always when you look at an old photograph and then you look at yourself in the mirror and go, oh, when did that happen? Now I have a question.
Yes, ma'am.
Like with the 11s.
Mm-hmm.
Like with mine, I was always told that I have really strong facial muscles,
Correct.
right? And that's why they always want to do Botox to relax that muscle.
So I'm not a real great fan of Botox.
Well, me neither. So
at all. I don't like snakes, and that's snake venom. That's what
Go
they
figure.
use to start this
Is
whole
there
thing.
heredity in that as well, or is it just that the muscles maybe heredity?
it's like a muscle that you see
It's
a
a
definition.
muscle, but it is definition, and it is your facial structure. So the way that muscle actually pulls against that area. So what we would use is actually the acupuncture itself to release that muscle, just like a trigger point that we would use in your shoulder, or in your back or your low back or anything like that. We would use it just the exact same way. It unravels very, very nicely into a relaxed position so that you don't have the dagger happening. Then we would follow it up with a little bit of collagen elastin, homeopathics, and you'd be on your way.
All right, if you're looking for me,
Because everyone in my family has these. So,
see, you don't.
well,
Not
they're.
too bad.
I've been using my jade roller.
There you go. There you go. That's
And
another part of it.
I have noticed that since I've been doing that, it has gone down a little bit.
Absolutely.
And a couple of years ago, they were a lot worse. I had a lot more stress. So that makes sense. I've worked on reducing my stress, and my father passed away, which was a big part of my stress. But everyone in my family has those. Some of us have one, some of us have two. But
I got 3. I got here, and then I got this one that's right across.
yeah, well, see, I don't know. Wouldn't see that because I wear glasses, and so does pretty much everyone in my family. But yeah, but I've been rolling that. I have noticed a difference since I've been rolling it with the jade roller.
Yep.
That
And that's also
Okay.
a part of the treatment as well.
yeah.
There you go. All right. Oh my gosh, so many
We have
great
so
things.
much fun.
So we have the acupressure, we have the acupuncture, we have the seeds in the ears, we've got the cupping, we've got all the great stuff for your face. Tell the audience again who you are and where we're at and how to get in touch with you.
Thank you. I am Dr. Karen Helmick. I am a licensed acupuncturist and doctor of Oriental medicine. We are at Healthy Body Acupuncture, located in Venice on 1511 Tamiami Trail South, Unit 202. Our website is www.acupuncturevenice.com, and our phone number is 941-228-4688. Thank you.
That's so exciting. And this is Beth Annie Stockdale. You can find me here. I'll be with Karen for the next 10 weeks. No, I'm at your Total Body Wellness Center located at 800 East Venice Avenue, Suite C in Venice, Florida, 34285. Call me, text me, 941-468-7091. A lot of what Dr. Karen was talking about as far as your brain health, I can do the assessments. You know, we can do some consultations with your permission. I can do the assessment, you know, if we're talking anxiety or ADD or depression, and then I can tell you what part of the brain is being affected, and then it's all good. You know, we get
the best results when we work together.
Oh, absolutely. Absolutely. It takes a village or a team. And
I'm Suzanne with Discount MedDirect. You can reach me at 941-421-7155. That is not a textable number. We use good old-fashioned landlines. You can reach us at info@healthsupercharge.com. You can find us on Facebook at Supercharge Your Health. Don't forget to like and share, and
that's right. This is Supercharger Health, and text us. You know,
comment on the videos.
Comment if anything you want to learn more about what Dr. Karen talked about. Well, we can do another segment because it is our desire for you to be well, feel well, and stay well.